As an oral surgeon, the number one application that I use a perilace for always is LAPIP. That's the number one. That's probably the most predominant use of the laser in my office. Second, I would say for the stasis control for the exposure and bond cases, for the deep impactions, having the hemostasis, the perilace, where again I know I'm not going to be causing nerve damage, I'm not going to be causing uncontrolled necrosis of the bone, and having something that's very heat regulated and being able to achieve stasis has just been extremely beneficial. And then third, I would say the biostim function, just being able to offer patients a way to heal a little bit quicker and have a little bit less postoperative discomfort really goes a long way, especially in my practice. The results were just as advertised. I mean, we definitely saw gain in detachment. We definitely saw some. It's been early still, so we haven't seen too much radiographic follow-ups, but you can definitely see the tissue has responded extremely well. But it was using the perilace outside of what was actually trained in the boot camp for hemostasis. I use it for exposure and bond cases, and before I was packing a ton of gauze, and where isolation was just so extremely important. And when you have a patient's palate reflected, now you don't need to pack it full of gauze and really go in there with 101 to 50,000 epinephrine to try to control the bleeding prior to placing the adhesion. So now I could just use the laser and I don't even need to worry about anything, and it just makes the procedure so much quicker, so much less invasive, and the patients just respond so much better. Being able to go through and do the LAPIP protocol and for the treatment of periimplantitis, there's more and more cases of periimplantitis popping up, and it seems like the more general dentists are really pushing implants, and a lot of people are learning how to place implants. There's going to be improperly placed implants. There's going to be people who might not be thoroughly trained in placing implants, and they're always going to be having issues. And it seems like it's becoming more and more prevalent, especially as people are trying to cut corners to cut costs on implant treatment. And because of that, the periimplantitis cases have just skyrocketed in our area. So being able to offer not only a painless procedure, but also a very successful procedure when periimplantitis, a lot of procedures just aren't very successful. So having something in our pocket that's able to provide that is just it's been so beneficial. But then outside of the periimplantitis cases, being able to achieve stasis, especially with so many patients on these 10A inhibitors and thrombin inhibitors, it's very hard to wean the patient off of the meds and know exactly what their response is going to be. And you could take out a tooth or take out multiple teeth, and next thing you know, you have a patient that's losing a lot of blood. And being able to have a hemostasis tool in my pocket that not only I don't need to worry about causing nerve damage, I don't need to worry about causing uncontrolled necrosis of the bone because of heat measures. Having something in my pocket to where I know I can always achieve stasis and do it safely and do it minimally invasive is just so beneficial. My patients responded extremely well to it. If I would sit there and go through, okay, we have an option of opening up your gums, doing this, and sutures, and possibly needing some pain meds for a few days or you could just get a laser and you're going to take one round of ibuprofen, and then after that, that's it. You're not going to have hardly any discomfort and minimal swelling and minimal downtime. It was like a no-brainer. And even if cost was an issue, it seemed like, oh, well, it doesn't matter how much it costs. This is what I want to do. And which was actually surprising to me, that that's the way patients perceive pain and perceive discomfort. It seems like there's no monetary there's no monetary limit as far as they'll go to that extent to be able to have that good patient experience or that good operation.